The essential thing is that any woman should make sure that she examines her breasts at least once a month. And as I'm sure many people know, our breasts change during the menstrual cycle. So the best is to choose about a week after you've had your period, when the breasts won't be quite as tense or swollen as normal. Examine each breast carefully and make sure that you feel up into each armpit. And you're looking to see, are there any lumps that you haven't felt before? Are there any rashes on the skin, any other blemishes or dimples that you've noticed? So really, if you get into a habit of doing that every month, month after month, you very quickly get to know what your own breasts feel like, so you should be able to spot any difference more easily. It's really, really important that people feel empowered if they notice a lump or any change in their breast, to seek help straight away. So the most important thing is to contact the GP surgery, get an appointment as quickly as possible, and actually if you state to the receptionist what the problem is, they will immediately know that this is urgent and you'll get an appointment quickly. The GP will see you and will refer you on, whether you choose to do that through the NHS or through a private referral. The process would be that you would see a breast surgeon, and they would do something called a triple assessment. So they examine you, you have an ultrasound, and you have a mammogram. And if there is anything untoward, you would have a biopsy there and then. And the aim is to turn all of that around as quickly as possible to give you peace of mind. So for the vast majority of women, there won't be cancer, and you can be reassured and leave satisfied that you're fine. For the minority who do turn out to have a cancer, again, it's really essential that you find out as quickly as possible, and then your treatment can be taken forward. It's really important that when you're being treated for breast cancer or for any cancer, that the doctors looking after you work as a team. So you will need a breast surgeon, you will also need an oncologist like myself, but there are people behind the scenes that the patient may not necessarily see, the pathologist and the radiologist who will look at your scans, who are also critical to helping decide what your treatment should be. So knowing exactly what type of breast cancer it is, how extensive or not it is, where it is exactly in the breast, all of those vital bits of information feed into how your surgeon and your oncologist will formulate a plan for you. Most often, the first treatment would be an operation, and your surgeon would talk to you about why that needed to be done, how it would be done, and as far as possible it would be expedited, so you would have it done as quickly as was possible. Then most often after the operation, you would come and see an oncologist like myself to talk about whether there was a need for any additional treatments. And that might be with medication, so it might be chemotherapy, or it might be hormonal tablets, because some breast cancers are very sensitive to hormones. It might be with radiotherapy, and it's just vital that every woman has access to the professionals with the correct expertise to give you the most up-to-date advice. I think what's essential with treatment for a condition like breast cancer is that the patient at every point feels that they're given the information they need to help make the decisions. Sometimes there isn't necessarily a right or wrong way of doing things, but you need to be able to see a professional who has the expertise in that area to explain to you what the options are, talk to you carefully and kindly about what your choices are, and you can then decide how you want to take it forward, and your oncologist and your surgeon are there to guide you with that.